Hi, I'm Debbie Knapp. I'm a distinguished professor and the Dolores L. McCall Professor of Comparative Oncology at Purdue University. I'm in the Department of Veterinary Clinical Sciences. There are several reasons why we study bladder cancer in Scotties. First of all, we're veterinarians and we understand bladder cancer is a pretty serious disease in dogs, and we'd like to improve the outlook for the dogs. Second of all, when dogs develop bladder cancer, it's really similar to high-grade invasive bladder cancer in humans. So when we learn information from dogs, we can learn information that we expect to help humans. Scotties we study because they have a very high inherited risk. They're 20 times more likely to develop bladder cancer than other breeds of dogs. So not only do they need help, but they offer us the opportunity to learn about the genetics that can increase the risk of bladder cancer and enable us to study the cancer from the very earliest stages through the more advanced stages. But what we did in the study that we just completed was rather than wait for the dogs to get cancer and develop symptoms of the cancer, such as difficulty urinating, accidents in the house, blood in their urine, rather than wait for that, we actually screened them when they had absolutely no symptoms, no outward evidence of anything being wrong with their bladder. So we screened them every 6 months for 3 years. We used a urinalysis and we used a urinary tract ultrasound, and so that enabled us to find earlier stages of the cancer when it was small, when the dogs had no symptoms, when it wasn't yet causing any bladder dysfunction, it hadn't spread. So this gives us the chance to study that very early cancer to see, does it respond better to treatment, which it does, and at the molecular level, how is it different? What is it that changes between the normal bladder and the early cancer and then the later cancer? Because that will enable us, if we can understand how bladder cancer ticks, then we can understand how can we intervene better, how can we find better drugs, and how can we treat it more effectively. There are things that the owners can do to reduce the risk if they own a Scottie or if they own a dog in another breed that has a high susceptibility for bladder cancer. So that would be Westies, Shelties, Beagles, other terriers. So first of all, there are things that they can do to reduce the risk that their dog will develop bladder cancer. And so that would include avoiding lawn chemicals, avoiding cigarette smoke, not letting the dog become obese, feeding vegetables. Scotties that are fed vegetables just 3 times a week have a 70% reduction in their bladder cancer risk. And then once the dog gets to be middle age or older, our study would suggest that it's time to implement screening more broadly across the high-risk breeds.